Hello and welcome to sqadia.com. I'm Dr. Mahanur Ehsan with another interesting video of hepatobiliary diseases. So let's start with a scenario. Suppose you are working in medical emergency and you come across a 35-year-old male patient who has presented with epigastric pain associated with vomiting, and on examination you found out that he is having tender abdomen. After this, you carried out investigations and they were as follows. In CBC, there was raised TLC count, LFTs were normal, amylase was raised, and lipase was also raised. So, a patient with epigastric pain, tender abdomen, raised amylase and lipase, what comes to your mind? Immediately, you will think of acute pancreatitis. We will talk about this today. So, here you can see this is pancreas and it is an important organ of our body, and it has two roles, exocrine as well as endocrine. First, let us see what is the exocrine role. Here, it has acinar cells which secrete enzymes that are carried by the pancreatic juice into the duodenum. These enzymes include proteases like trypsin, chymotrypsin, amylases for starch digestion, and lipases for fat digestion. These enzymes are kept in inactivated form called zymogen, and they are only activated normally when they enter the duodenum, where they encounter the food, and there they have role in digestion of various components of food. So this was the exocrine role. But pancreas is also having endocrine function. That is, it is also involved in secretion of hormones, and they are insulin, glucagon, and somatostatin. So this is the normal role of pancreas, but acute pancreatitis, which is basically the acute inflammation of the pancreas, it involves mainly the exocrine part and the enzymes which are abnormally activated and cause damage to pancreas itself. So let us see the pathogenesis. First, we will see what are the factors which actually cause the pancreatic enzymes to be abnormally activated. Let's start. First is hyperstimulation of pancreas, that there is some condition which will cause abnormal stimulation of pancreas. For example, it can be alcoholism or it can be hyperlipidemia. Then other factor is reflux of infected bile or duodenal contents. We have seen that pancreas is having association with liver, with gallbladder as well, and the pancreatic duct is also opening into the duodenum, which is also receiving the bile duct, which is carrying bile from the liver and gallbladder. So if there is reflux of infected bile or duodenal contents, that is also going to affect pancreas. Now, what causes the reflux? If there is sphincter of Oddi dysfunction, so it is an example that can lead to such reflex, and it will cause abnormal activation of the proenzymes or zymogens. Then next is pancreatic duct obstruction. So if there is any stone, for example gallstone, that has migrated down, it can lead to pancreatic duct obstruction. So it can be due to stone or it can be due to any carcinoma, and it will cause increased pressure in the pancreas. Next is defective transport and secretion of zymogens. So there is some problem with the zymogens or their intracellular extracellular transport mechanism that will cause their activation within the pancreas. So hyperstimulation, abnormal reflux, obstruction of the pancreatic duct, or defective transport of the pancreatic enzymes. Any of these factors will cause the pancreatic enzymes which are normally activated in the duodenum to be stimulated, and now they are going to be activated within the pancreas. And when they are going to be activated in the pancreas, they will cause damage to the pancreas itself, and it will lead to edema and inflammation, and that will cause acute pancreatitis. So in simple words, it is basically the inflammation and damage to the pancreas which is caused by activation of its own enzymes. So the pancreatic enzymes, they will start the autodigestion of pancreas.